Hey guys, do you suffer with a nagging shoulder pain? Especially when you raise your arm, kind of about to here in this area here. Often the pain is it's kind of a dull ache. It almost seems a little bit deep and it's towards the front. So you can almost put your finger on it, but it seems a little deep. And when you bring your arm up, you can just kind of feel that lingering on chronic pain. So a lot of people think, maybe there's a tear in your rotator cuff or even your labrum of your shoulder. It's a feeling of weakness. Sometimes when you're like pushing something, maybe you're lifting something. So we want to know if you're experiencing an impingement syndrome. 80% of the patients that I see with shoulder pain, if they haven't been in a trauma of any sort, 80% of them, they're usually dealing with some type of an impingement syndrome to their shoulder. Hey guys, I'm Dr. Emmett Blahnik, founder of nextlevelhealth.com, and I'm your virtual health expert, here to help guide you and get you to the next level with your health, happiness, and lifestyles. Today we're going to be discussing that lingering and annoying pain in your shoulder due to impingement, referred to impingement syndrome with your shoulder. I'm going to cover 3 things to help eliminate pain in your shoulder from an impingement, including stretches, strengthening exercises, and even supplements for inflammation and pain, and how you can use your Swiffer to help fix your shoulder pain today. Yeah, that's right, you heard it from me. Use a Swiffer in your house to fix your shoulder. But first, let's describe the signs and symptoms of shoulder impingement. How can you tell if that's what it is? Well, pain, typically when you're lifting your arm, you start to feel that pain right around the 60 to 180 degrees. And then if you actually keep going up, that pain almost goes away. And that's a telltale sign that you're dealing with an impingement. So as we're looking at what's being impinged, there's tendons and there's bursas that get impinged when you're lifting your arm to a certain degree between your acromioclavicular joint, your scapula, and your humerus. They actually rub against these tendons and this bursa, and it can actually cause a fraying effect. It can actually create inflammation. So tendon is getting inflamed, which means you might be experiencing tendinitis. Or that bursa would get inflamed, which means you would be experiencing some pain from that, some discomfort with that, which would be a bursitis. So you could be experiencing the pain and discomfort from the rubbing of that tendon, which is creating the tendinitis and bursitis. So we want to actually get that inflammation to decrease. Otherwise, if that tendon continues to get rubbed on, what it could do is it could fray it, and you could actually create a tear in your tendon of one of your rotator cuffs. So one of the things that we want to do is start to eliminate what's rubbing against the tendon and the bursa, so you can decrease the pain, the inflammation, and get your joint capsule back to where it needs to be. Other symptoms include pain in the front. Actually, kind of more pain in the front of the shoulder. You're going to experience it here or towards the top. And again, it almost feels a bit deeper where you can't necessarily put your finger on it. It's not superficial. It's a little bit deeper. That's why sometimes it mimics what people think of as a tear to a rotator cuff muscle or a labrum. Weakness. So weakness pushing, okay? Or lifting something overhead. Maybe even throwing like a baseball or overhead types of activities. Often people with shoulders that are rounded or forward, and this can be many people where this happens a lot from. Again, 80% of the people with shoulder pain and impingement that wasn't due to a trauma. It may be due to kind of the way you're sitting, maybe at a desk job. Your shoulders are rounded. Also, like if you are rounded like that and you're doing some overhead, or your arms are up here like you're cutting hair, you're a hairstylist, you're kind of doing this kind of stuff, or maybe you're a hygienist, a dental hygienist, or even a dentist. So it's the rounding and then things that are working up here, you're going to be the culprit more often. You're going to experience this more often than other people. Also, maybe women that are a little bit heavier chested up at the top, they tend to have their shoulders rounded forward, and then any type of activity up here, you're just going to be plagued a little bit more with this shoulder impingement syndrome. So if you're experiencing some of that pain in this area right here between 100 degrees and it kind of goes away, you're probably dealing with that shoulder impingement. Another sign is this. Why don't you go ahead and stand up for me? Your thumbs should normally and naturally, if you just let your arms hang down, your thumbs should be pointing outwards straight forward like this. And if you have that rounded shoulder, what you're going to notice is that your thumbs kind of point more towards this direction. So if you're standing there normally and your thumbs kind of go more inwards like this as they hang, you might be dealing with more propensity for shoulder impingement syndrome. So let's tell you what's happening here, okay? The pec muscles, what's making all of this happen. So the pec muscles, they're going to be a little bit too tight. So what that's going to do is it's going to draw the humerus forward, it's going to draw the scapula forward. We're getting into that impingement of the tendon and the bursa. And so what we want to do is we want to help to loosen that up. Bring your shoulders back, bring the muscles back to stability. So we're going to go through a couple things, a couple stretches, strengthening exercises, and supplements to help reverse this impingement syndrome. So let's get to it. Let's start doing some stretches for the pec. So the first one that we want to do is we want to stretch that pec muscle. I really like this one. It's simple. Do this in your doorway. So just raise your arm to about 90 degrees. And then you're gonna just lean forward into your pec, kind of turn your torso into it there, and you're gonna start to feel that nice tension, and do it until it's tolerable. So tolerable to your tension, but you want it to be stretching there. What I would do is I would hold it for about 60 to 90 seconds. Do that 1 to 3 times, stretching that pec muscle. So that's one way you can do it. The other one I like is, again, how can we use the Swiffer? So I'm just gonna take a normal Swiffer, and so you can actually remove some of these pieces here. And what you're going to do is you're going to put your finger in this thing here, and you're going to use it to start to stretch. Anya's going to demonstrate it there. You're pushing it forcefully against the wall. And I usually have like a Velcro thing on this and the wall. But what she can do is she can forcefully put it in there, lean into it, and she's stretching that muscle with getting a good range of motion in there as well. So another way we can do this is if you'll come on over here with me. Okay, so another version of this is go ahead and stick your finger in there so you got a good grip. Keep your arm extended. And then what you can do is you can just use this on a chair or some type of bench of some sort, and then just lean into it. And I like this one because she can now cavitate, put a little pressure there while also getting that stretch, getting that good arc, that range of motion as well. So just imagine this being on a bench, a chair of some sort, so you can do it on there. You can also do it on a floor. So if you would just picture this bench as your floor, another way you could do this is just simply on your floor, which I tend to think is the easiest way to use the Swiffer to do it, is, again, getting that good range of motion with the Swiffer. And then stretching, so you lean your torso in this way, there you go, and you'll feel that stretch in there. One of the most effective ways is really the door, leaning into the door. And then the Swiffer one is a good one. So that's a couple stretching components. And now what we want to do is look at another thing that we have to stretch, which is your capsule, your joint capsules. So another great stretch of the joint capsules in your shoulder, which would be helpful for an impingement, is something that I refer to as a pendulum swing, or around the world. So what we're using a kettlebell right now. But you want to use weight that's tolerable, and whether that's a 2-gallon jug of water or some other weight, just go ahead and lift it up, straighten your torso, and let this go down and cavitate, and then just swing it around the world. So if you're using a bench or you're using a chair, Let this really kind of drop. Let it go. Keep going. Go, 30 to 60 seconds in one direction, and then reverse the rotation the other way. This one feels absolutely phenomenal when you're dealing with a shoulder impingement type of syndrome. So what I would do is, again, 30 to 60 seconds each direction, and maybe do that a couple times a day. So another final good thing to open up the pecs, kind of release the tension on all of that, bring that shoulder back, is something that you can do is just lay on a foam roller. You can lay on a exercise ball, or if you just wound up a bunch of towels to about that diameter, really tight, essentially just put it between your shoulder blades, lay back on it, and then just allow your shoulders to come back. Allow your shoulders to come back. And what you can just simply do that, kind of extend your arms out, okay? And or if you kind of bring them up and do a couple circles, yep. So think of yourself making a snow angel, and just let that kind of relax, let that tension go. So that's another great one that you can do. Another version of this, if you could go ahead and sit up for me, Anya. Another version of this, if you don't have access to this, or maybe it's a little bit too much on your shoulders, is using an exercise ball. So why don't you come on over here with me? So ease yourself into the exercise ball, but again, open up your shoulder blade, or open up your shoulders there. Maybe do a couple of those snow angels and just let it rest. So I would do this maybe 60 to 90 seconds. Take a couple deep breaths, do that 2 to 3, 4 times. That'll help stretch out those pecs and relieve some of that tension on your shoulders. So we're gonna move from stretching, so we're stretching out things, and now we gotta strengthen muscles to hold things where they need to be. So we're gonna move into some of the strengthening components. And one of the first things, if you wanna just have a seat here with me. So one of the first strengthening exercises is to do some shoulder blade repositioning. So one thing that you can do if you don't really have any type of equipment is just use your own arms. So let's bring your arms shoulder width height, bent at about 90 degrees. And what I want you to do is I want you to pinch your shoulder blades. Pretend you got like a quarter between here, okay? So once you get them pinched, then what I want you to do is I want you to try to drop your shoulder blades into your back pockets. And it's that movement. So let's start it again. Pinch the shoulder blade and then drop it into the back pockets. Go ahead and do that again. Pinch the shoulder blade, drop it into the back pockets. So I would do this 10 to 15 reps and maybe 3 to 4 times. That would be a good place to start. So even more effective is using some type of resistant band. So a TheraBand, so a resistant type of band here, or everybody knows those resistant tubings. So today we're just gonna use this TheraBand. So you're essentially just gonna kind of wrap it like this to the tension that you need it to. And then do that same movement. Again, it's gonna give you some resistance, but just a bit more effective. So if you want quicker results and you can tolerate the tension, go ahead and do those exercises just like that. So another version of this, which is equally, if not more effective, is going into a wall version of this and doing some pullbacks. So let's go ahead and take a look at that. Okay, so the resistant bands with the tubes, what we're doing is we're just attaching it to the doorway here. And I actually like to have a little bit higher, about head level, eye level, or maybe a little bit further, because we want those shoulder blades to drop down. So go ahead and grab this, and we're gonna do some pullbacks there. So just step back until you can tolerate the tension. In similar form, you're gonna pull it back and then drop it into your pocket. Pull it back, drop into your pocket. Perfect. Let's just keep doing that. Do 10 reps, 2 to 3 times. So do about 10 reps, 2 to 3 times. Remember, try to picture a quarter between here. Pinch that quarter. Drop those shoulder blades into your pockets at the end. Great job. Another great strengthening component is external rotation of your humerus. It's going to help stabilize that rotator cuff and joint capsule, help reduce the impingement type of syndrome. So what you're going to do is you're going to get some type of resistant band. I like it about belly button height, And I want you to think of starting with your wrist here at your belly button, and I want you to pinch your elbow into your side. Don't let it wing out here. So you're gonna keep this to your side. You might even wanna have like a towel or something in here and just pinch that. And essentially what you're gonna do is you're gonna externally rotate it. Just bring it out like that. Again, try to keep that elbow in tight from your belly button and out. I would do 10 to 15 reps, 2 to 3 sets of that. So if you don't have a resistant type of tube here, another version of that is, again, we can go back to the TheraBand and just getting it into a position where you can just go like this. External rotation. Another version of that, we're going to use the table, is just laying on your side on a table like this. And again, thinking of where your belly button is, and you're just gonna lift it up like this. So if you have a wrist weight or you have a dumbbell, what you can do is you can just use that wrist weight, dumbbell, or maybe even a gallon of water or milk or something like that, and just lift it up like this. So keeping this pinched, maybe have a towel pinched between here. Again, belly button and up, external rotation. So a couple other great things to implement that I would encourage you is that external rotation of the humerus. So just another couple versions of this, which I really like for shoulder impingement, is you're gonna be, let's say, on your belly, whether it's on a bench, or you can picture this being your bed, okay? Maybe have your head off your bed like this, get your head up, straight position, lift your head up, and then you're gonna do the Superman. So go ahead and stick your arms out. All right, a little bit of an angle here, and then what you're gonna do is you're gonna bring it down, and then you're gonna squeeze that quarter between your shoulder blades. Get that Superman out there a little bit more, okay? And then drop it down and squeeze it out. So again, 10 reps, 2 to 3 times. Another good one is if you think of a field goal, okay? Pretend you're gonna, the sign of a field goal, okay? You want your thumbs up and then bring them down and then pinch that quarter between your shoulder blades again, just like that. So what you're doing is you're using gravity for some of that resistance. So if you don't have the bands and all those other things, another effective way to get those shoulder repositions, shoulder blade repositioned. All right, perfect, great. Okay, just a couple final other versions of the strengthening exercises is what I like to do is an overhead shoulder adduction. So essentially you're gonna kind of just do the wave and press your arm against the wall with that full range of motion there. And again, you're using gravity and you're using muscles to strengthen up. Again, what I would suggest is maybe doing 10 reps here, 2 to 3 sets. And another thing that you can do simultaneously once you do this is do some wall slides. So bring your arms to 90 degrees. And I actually want you to press a little bit, so maybe wearing a shirt sometimes, a long sleeve shirt when you're doing this one so you don't like rip up your arms. So kind of actually press against it a little bit, give yourself some compression, and then just slide your arms up and down the wall to about shoulder level and then up. Again, 2 to 3 sets, about 10 reps with those wall slides. And then finally, you guys, we can't help but look at other contributing factors which may be existing in the neck. So if you're simultaneously having some of that neck pain that might be radiating into the neck muscles here, your nerve system in your neck, the nerves that come out of your neck, they actually influence or they innervate or they control all of the muscles of the shoulders and the rotator cuff. So it may be worth it to have your neck looked at professionally, maybe get a second opinion. Especially if you have that neck pain, you might need an x-ray of some sort to see if there's anything going on with your neck, spine, and nerve system. So ask your chiropractor to take a look at your neck as it relates to your shoulder impingement syndrome. Because if you're pinching or damaging any of these nerves in your neck that lead into your shoulder or your rotator cuff muscles, that might be the thing that's actually weakening some of the muscles. So some things may be stronger that need to be stretched, like your pecs, and then some things may be weaker, like some of your rotator cuff muscles. and some of that weakness might be coming from an interference and impingement in your neck. So go to your chiropractor and make sure they're taking a look at the integrity of your spine and your nervous system, specifically as it relates to your C4, 5, 6, and 7 nerve roots. So finally, what we got to make sure that we're taking into consideration is the inflammation and the pain, particularly if it's tendonitis or that bursitis, and then obviously some of the discomfort and pain. And so one of the first things that I would do is start to look for that turmeric and bromelain, because turmeric, such incredible anti-inflammatory properties. I mean, studies and findings out there right now, everybody's using turmeric to decrease the inflammation. And bromelain is a proteolytic enzyme. It helps decrease some of that discomfort with it actually kind of has a calming effect. So the turmeric and bromelain, I like that to decrease some of the inflammation together. That bouquet together is really working extraordinary for some of our patients that are dealing with chronic inflammation. And everybody knows right now, even doctors are prescribing that people are taking their omega-3 fats. In terms of our omega whole body version here, 1,200 milligrams. What I would take between the omega fats is, if you're dealing with a bursitis or a tendonitis, something's inflamed, I would generally take a therapeutic dose, somewhere between 2,200 to 3,400 milligrams of omega fats here. These marine fats are good for inflammation in the joints, the tendons, your cardiovascular system. So get that therapeutic dosage of omega fats. You can also think of your good fats, you can kind of think of it as the lubricant for your joints. So you need good, it's like WD-40 for your car joints. You need lubricants for your joints, and good fats actually provide that type of lubricant. And then more studies, everybody is hearing the word CBD now, is hearing more and more about the benefits and value of cannabinoids or CBD. And so I would encourage you to use maybe roughly, if you're going through like one of these tendinitises or bursitis or impingement type of syndrome and you're really in pain, the combo effects here between the turmeric, bromelain, CBD surge, and our omega fats has just done extraordinary things for some of our patients. But I would take roughly about 500 to 1,000 milligrams, maybe even a couple times a day, until you get this to calm down a little bit. And this sweet bouquet, this triple threat, is going to help you dramatically. So if you stick with the three things here, the stretches, the strengthening exercises, and some of these supplements, I believe that your shoulder pain, if it's due to impingement, will go away relatively quickly. You'll probably start to see some results within a week to 2 weeks, and hopefully this helps you guys. How should I wrap this up? Yeah, there you go. So, hey guys, hopefully this has been helpful for you. On behalf of nextlevelhealth.com and the Virtual Health Expert Show, I want to thank Anya. And this is Dr. Blahnik. Until then, I'll see you soon.